grow children with strong teeth. The main oral disease is dental caries, which is the most common childhood disease in the world. 1 in 2 children has caries before the age of 5. Theoretically, dental caries can attack a child's teeth as soon as they first appear in the oral cavity, for example between 12–15 months, although it is more common to appear after the age of 2. We know this sounds bizarre, but it is true. Let us see how and why in such a small child caries can occur. Dental caries is a multifactorial disease and is due to the coexistence of 4 major factors. The host, which is ourself, hereditary, which has to do with the type of our saliva. The nutrition, which has to do with the consumption of sugar and starch. The time, which has to do with how often the child consumes sugar and for how long it stays on the teeth. The bacteria, which relates to the number and size of the bacterial load in the saliva. To sum up, the caries procedure is as follows. If a child holds a bottle of milk at night, wakes up at night and asks for milk, or sleeps without brushed teeth, this automatically means that the lactose, which is sugar, stays on the teeth for many hours, and this helps in the development of bacteria. These bacteria combine with the sugar and produce increased amount of acids, which in turn dissolves the calcium from the teeth because the saliva is greatly reduced, especially at night. If the same child has the inheritance factor against him, meaning that he has an acidic and viscous saliva, then he is at risk of developing caries at a very young age. This type of caries is called early childhood caries at a severe form. It evolves quickly and is capable of completely destroying the child's teeth. Such teeth cause pain and infection to the child, difficulty in chewing and eating properly, which results to many underweight or even suffering from anemia children. They need immediate treatment, which is painful and difficult for both the child and dentist, since it requires high cooperation. It also costs because often the child has to get sedated to receive any type of treatment. Do not worry, your child is not going to have such a problem because you are here and we will inform and educate you. The main cause of this condition is ignorance. We want you allies in this endeavor. This is what you can do in order to prevent tooth decay in your child. Brush your child's teeth with a fluoride-based toothpaste before going to bed and after the last milk intake. This helps eliminate the causes of tooth decay, for example bacteria and sugar. This way, no harmful acids are created which dissolve the calcium of the teeth, which in turn leads to decay. Germs play a huge role in the development of caries at an early age. Research has shown that the more germs a mother has in her saliva, the more she transmits them to her child if she kisses the baby on the lips. So avoid transmitting your saliva's germs to your baby, either by kissing or by using the baby spoons and glasses. When your child starts having teeth erupt in their mouth, avoid giving them a milk bottle during the night. Breastfeeding is blessed. However, if after the age of 1, when the child has teeth erupted, you're breastfeeding upon demand, the child is at risk of serious caries, provided that he has a bad saliva. Research shows that when breastfeeding occurs more than 7 times in 24 hours after the age of 1 year, it increases the risk of the baby getting tooth decay. If you brush the teeth and gums well with a damp cloth after each lactation and brush the teeth in the morning and evening with toothpaste, the chances of damage are greatly reduced. Of course, with the above information, you have questions and may even be surprised. We are here at your disposal for questions and explanations. Before we close, let us remind you of Hippocrates' saying, "Prevention is better than cure." This is also our principle.